13 Live at 5 begins right now.
Women, for example, that are diagnosed with breast cancer with no insurance die at about double the rate of women with health insurance. We also know
tonight's top story, a drive on two fronts to bring health insurance to all Americans. Good evening and thanks for joining us. I'm Benita Zahn. Jim is off tonight. Presidential candidate Hillary Clinton today added her name to the growing list of advocates demanding health care for everyone. Meanwhile, the nation's richest health charity shifted policy and is calling for the same goal. News Channel 13's Bill Landon joins us now live. He's got more on tonight's top story.
Benita, the estimate is 47 million Americans have no health insurance. Tens of millions of others have some coverage, but find it is inadequate. Whether there should be health coverage for everyone has become a major issue in the 2008 presidential race.
This is Kathy. She recently lost her job.
This emotionally wrenching television ad comes from the nonprofit, politically neutral American Cancer Society.
Now that she's been diagnosed with breast cancer and can't afford insurance, she's wondering if the next thing she might lose is her life.
The reason is simple. Leaders have concluded that if nothing is done, lack of health insurance coverage will soon be the leading cause of cancer deaths in this country, surpassing tobacco by the year 2015.
So with access to insurance, we know that people can get screened sooner, diagnosed earlier, and treated more effectively.
Although the American Cancer Society is not endorsing a political candidate or position, their call for universal affordable health coverage echoes a major campaign theme of most of the Democratic contenders. Today in Iowa, New York Senator Hillary Clinton detailed her plan.
If, however, you don't have health insurance or you don't like the insurance you have, you can choose from the same wide variety of private plans that members of Congress choose from.
Clinton's plan would require employers to offer health insurance or pay into a fund providing coverage, and all individuals would be required to carry coverage, much like all drivers are required to have car insurance. But the New York State Republican Committee says it would tax more, spend more, and exert more government control over people's medical care. Senator Clinton claims that if everyone is required to carry health insurance, overall costs would go down because we won't be paying the large hidden price for the uninsured, and competition will drive down soaring rates. Right now, the issue is splitting along party lines, but with so many unhappy with the current system, opposing major change may prove a very risky strategy. Bill Landon, News Channel 13.
Bill, just a quick question. In Massachusetts, then Governor Mitt Romney basically required the same thing, though, didn't he, as a Republican?
Well, yes, he had a plan, and Massachusetts has a plan that is, in theory, going to provide coverage to everybody, although there are issues about that in Massachusetts. And one reason why New York State, and of course overall in the nation, they're talking about this is because they haven't been satisfied with the efforts so far from Massachusetts and California, but people argue, hey, at least it's something.
All right, Bill, thanks very much. Well, health care is second only to Iraq in the minds of American voters. That's according to an August poll by the Kaiser Family Foundation. It finds 27% of voters surveyed feel health care is the second most important issue that needs to be addressed by the government. The economy, immigration, and terrorism round out the top five.